I'm extremely passionate about staying away from abstinence-based care. And I'm not saying that doesn't mean that people can't be abstinent from drugs. That's not at all what I'm saying. I'm one of those people that is abstinent from drugs and alcohol. So I'm the last person that's why people shouldn't be abstinent. But I think what happens for me is I get extremely frustrated. I've been working in the industry of substance abuse, and I have my own lived experience of substance abuse. And I feel like people are constantly being set up when it comes to addiction, and they're being told that the only win when it comes to substance abuse is being abstinent, or addiction is being abstinent. And it's not realistic for so many people out there. So many people out there that are struggling with addiction, doesn't matter what it is, it doesn't have to just be drugs, is they can't find abstinence, and it's not due to lack of trying. I have seen it over and over again where people are in their 17th, 18th time in clinic and they can't hack it as it's stated when they're there. And then what happens is they get scrutinized and they get looked at everything they didn't do when they were needing sobriety. So I have a massive issue with that, because what it's stating is that abstinence is a choice. And when it comes to drug addiction and when it comes to addiction is not a choice. People don't wake up in the morning and say, I want to be an addict and I want to be labeled an addict and I want doom and gloom for the rest of my life. There is a reason for some, not all, the reason why they use. And it's about looking beyond abstinence and saying there's a reason why this person is struggling to stop. We've got to look at all the aspects why, and we shouldn't make the only criteria for success abstinence. We should be meeting the person where they're at and saying, what do you see as your wins? Does that mean using twice a week? Does that mean using 3 times a week? What are your wins? What are your emotional goals that you want to be reaching? Do you want to be connecting with yourself? Do you want to be connecting with your families? So the landscape of how we approach addiction drastically needs to change. I am extremely passionate, especially in the year of 2025, about pushing the fact that harm reduction is about emotional care, safety, and dignity for those that are addicted.